morning, everybody. I think we'll get started. It's 10 o'clock. And we'll begin notes. I'd like to welcome everyone once again, and this being the 5th meeting of the PFAS Interagency Task Force. Welcome members of the public, and all other groups and stakeholders watching online today. I know we have a lot of folks that do watch. We hear from you, and we're grateful for your interest and the participation in which we see taking place across the state. Thank you all for your continued interest and participation. It's much appreciated. Before I get started on the topic and introduce our guests, I would like to acknowledge that this will be the last hearing for our 2 task force fellows and interns, Adisha Trivedi and Gloria Kang. You may not know them by name, but they have been working tirelessly behind the scenes to ensure that hearings run properly and that as we go, we write in terms of our report and our recommendations. We've been so fortunate to have you both with us and wish you all the best in your future endeavors. And I'm confident you'll both succeed in whatever you set your minds to, and you'll certainly be memorialized in our recommendations. So thank you both for your efforts and your work. They are much appreciated. So the topic of this 5th meeting of the PFAS Task Force is to learn about what actions are being taken place at the federal level as well as other states to address PFAS contamination. PFAS is something that we have dealt with in Massachusetts for years, but we're not alone in fighting to address the contamination. We've heard in previous presentations that studies estimate 98% of residents nationwide have detectable levels of PFAS in their blood, and there's a growing movement to confront this issue across neighboring states and in our state capital. Today's presentations give us the opportunity to study how our federal government and other states are working to address these contaminants. We'll hear testimony from 4 stakeholders today. First, we'll hear from Congresswoman Lori Trahan from the 3rd Congressional District, which is the district in which I am a state representative, and she is truly a champion on this and so many other issues. Dr. Pat Bricey, Director of the National Center for Environmental Health and the Agency for Toxic Substance and Disease Registry at the CDC, joins us to discuss actions being taken by the CDC and the federal government. Kristin Hildreth, Legislative Director, and Shelley Oren, Research Analyst, join us from NCSL to discuss action and legislation tracking across the U.S. And finally, Kathy Beam, Planning Administration at the New Hampshire Department of Environmental Services, addresses concerns and how they're being dealt with by our neighbor to the north. We'll follow the similar structure to past meetings where our testifiers will share about 20-minute presentation, followed by a few questions before we proceed to the next presenter. We continue to encourage and appreciate participation of all task force members. Certainly you are here because of both your knowledge, your interest, and your advocacy. And a reminder that the goal and statutory obligation of this task force is to compile a report which addresses both the extent of PFAS chemicals and the risks to our health and environment, and to suggest regulation or legislation to address how to mitigate those risks. Today's presentations provide insight into how other jurisdictions are doing this, simply put. And another reminder that questions or comments can always be submitted by email to Griffin in my office and Jeffrey and Senator Sears. And inquiries from members of the press should be addressed to Allison in my office and Jeffrey in Senator Sears' office. To get us started, I'd like to welcome Congresswoman Lori Trahan, representing the Massachusetts 3rd Congressional District, which includes mine. I am the 3rd House District. Congresswoman Trahan is a Lowell native, served us well in Congress since 2019, where she is a champion for the issues facing each of her 37 cities and towns. Congresswoman has used her seat on the House Energy and Commerce Committee to push legislation that will address the imminent threats posed by climate change and protect the Commonwealth's waterways and drinking water supplies, of which we are most grateful. In addition to her efforts to clean up rivers throughout her district, especially the Merrimack and Assabet, we like to name our rivers out here in west of Boston that are affected by combined sewage overflows. She's also a critical partner in our efforts to address the harmful effects of PFAS contamination. The communities that we both represent have been adversely affected by exposure to these dangerous chemicals, and I'm very grateful for the role in advancing the Pfas Action Act through the House of Representatives in recent weeks. This bipartisan legislation will bolster our efforts here in Massachusetts, and I look forward to hearing from you, Congresswoman Trahan, about specific provisions and the path forward to get the federal resources we need to clean up contaminations and prevent future exposure. Welcome, Congresswoman Trahan. Thank you for joining us today. We're so very grateful.
Well, good morning, and thank you for inviting me to testify before the task force today. I'd like to start by thanking our co-chairs for their work to establish the PFAS Interagency Task Force, and to all of its members present today for taking the threats posed by these forever chemicals so seriously. I'm honored to call Chairwoman Kate Hogan not just a colleague and a partner, but also a dear friend. For those of us who know her well, her relentless commitment to tackling PFAS contamination is hardly a surprise. In fact, it's exactly the kind of leadership that I and the hardworking folks she represents in the Third Middlesex have come to know well over the years. And the same, of course, can be said for Chairman Julian Cyr, who has never shied away from doing what's necessary to combat PFAS exposures wherever they arise and provide necessary assistance to families facing the devastating effects of PFAS contamination. So grateful for the opportunity to testify before each of you and the distinguished members of the task force this morning about the dangers of PFAS chemicals and what is being done at the federal level to support critical efforts like yours. PFAS chemicals are an urgent public health threat. They have long been linked with adverse health effects, including cancer, immune system effects, infertility, impaired child development, high cholesterol, and thyroid disease. To make matters worse, these chemicals are extremely persistent in the environment and are known to bioaccumulate in humans and wildlife, meaning they don't break down or expire as quickly over time, and that is why they're referred to as forever chemicals. Contaminations have been uncovered in communities across our country and here in the Commonwealth in recent years, showing the need for us to take swift and comprehensive action to clean up contaminated sites and prevent future contaminations. But for a long time, and despite the EPA knowing the risks, the use of PFAS chemicals have gone unchecked and unregulated. In fact, they're still used in some common products like firefighting foam, nonstick cookware, cleaning products, personal care products, and even some cosmetics. Massachusetts has taken action on this important issue already, but as we all know, federal action is necessary to both support those efforts while also preventing other states from falling further behind. Last month, I and a majority of members in the U.S. House voted for the Pfas Action Act of 2021. This bipartisan legislation that I had the ability to help usher through the House as a member of the Energy and Commerce Committee will clean up contaminations like those here in the Commonwealth, provide support to families who have been exposed to PFAS chemicals, and take action to prevent future exposures. Specifically, the legislation requires the reporting of PFAS releases along with ongoing monitoring for PFAS in drinking water. If passed, the PFAS Action Act would also mandate the immediate cleanup of sites contaminated with two of the most hazardous types of PFAS, known as PFOA and PFAS, while also requiring the development of needed health and safety studies on all other PFAS. So the legislation sets air emission limits, prohibits unsafe incineration, and limits the introduction of new forms of PFAS into circulation. The bill recognizes the need for transparency and requires the EPA to develop an accessible website with information on how families can get their water tested for PFAS and to keep communities informed. And finally, and most importantly, for the purposes of today's hearing, the PFAS Action Act limits exposure to PFAS by requiring the EPA to establish a drinking water standard for PFAS that protects public health, including the health of vulnerable populations like pregnant women, infants, and children, while also holding polluters accountable. So the PFAS Action Act passed the House of Representatives with the support of nearly 24 Republicans, meaning that it isn't some issue that can be labeled as only a Democratic priority by any stretch. And we know that there is some interest from some moderate Republicans like Susan Collins in the Senate in doing something to stem PFAS contamination. So it's incumbent on us making the case to them to support this legislation. We're also seeing an unprecedented level of engagement from the Biden administration on this initiative. For a long time, the EPA stayed away from the PFAS issue, and that inaction is what got us to this point where states have had to act in the absence of and without robust assistance from the federal government. President Biden came out in strong support of this legislation, and it is my hope that as we work to get this done in Congress, that the administration will use whatever levers possible to get resources to communities like those here in Massachusetts working to address and prevent contaminations. One reason we're here today is because Massachusetts, under the leadership of many of you here this morning, has begun to take that action. Since the state implemented new PFAS regulations for drinking water supplies, we're quickly becoming aware of just how prevalent a problem forever chemical contaminations are. Already dozens of communities have reported elevated levels of contamination that need to be addressed. Some communities, like Littleton, have also been very proactive in their response to PFAS contaminations, choosing to take advantage of low-interest loans through the state revolving loan fund to finance the construction of a new treatment facility. Look, no one tuning in this morning is oblivious to the fact that cleaning up these water sources is not cheap. Towns like Ayer have already spent $12 million on PFAS mitigation, and it's clear that more small towns will have to make similar investments in the months and the years ahead. And if we're going to make meaningful headway in addressing contaminations facing their residents, they're also going to need investments from the federal government. So the PFAS Action Act would actually further support these efforts by providing grants exclusively to impacted water systems looking to clean up their contaminated sites. What the recent reporting of contaminated communities has shown is that the district I represent is disproportionately affected by PFAS contaminations, including in places like Ayer, Chelmsford, Littleton, Acton, Hudson, Stowe, and beyond. Whether that's because of the proximity to former Department of Defense sites, which we know have historically led to increased PFAS contaminations, or along our rivers and our wells, or because of a combination of issues, it's not something we can let go unaddressed. And what we've acknowledged here in Massachusetts, thanks in large part to the efforts of members on the task force, is that it takes a whole of government approach to responding to PFAS contamination, and the PFAS Action Act is necessary to make sure that the federal government is doing their part in this partnership. But we also need other states to do the same. Much like sewage overflows, PFAS contaminations have the ability to cross state lines and affect other communities. If the sewage system in Manchester overflows, communities downriver, like in Lowell and Lawrence, are affected. And the same goes for PFAS releases into water supplies. We can't have one state treating this threat with urgency while others are failing to do the same. So the federal standard required by the PFAS Action Act will require every state and water system to take responsibility for reducing PFAS in our drinking water. So the need for action at every level of government couldn't be more glaring, and we're incredibly fortunate to have leaders here in Massachusetts who refuse to wait until it's too late. And that's the same approach that we took when we drafted and passed the PFAS Action Act in the House. And it's the same one we're going to need the Senate to take without delay so that we can get this crisis under control. I'm grateful once again to you, Chairwoman Hogan and Chairman Sayre, as well as the distinguished members of this task force for the opportunity to brief you all on this important legislation. I certainly look forward to continuing our work together to advance long overdue and common sense proposals that will get this public health threat under control. Thank you.
Thank you, Congresswoman Trahan. Really appreciate your time. I know how busy your schedule is, and to have this update and to see some real tangible progress at the federal level. This is a very broad, big challenge. It's a costly one, and so to have the federal government and you and your leadership really is the partnership we've been waiting for. Are there questions for the Congresswoman?
If I might,
yep, please chime in.
My co-chair. Congresswoman Trahan, what are the issues, or where do you feel the state can be most effective in either complementing or driving the legislation that you have passed through the House at this point?
Yeah, look, the state of Massachusetts has, as it often does in so many policy areas, sort of led and really has set a bar, for us to ensure that other states, meet and follow. I know that certain things that you all have held up as examples of what PFAS legislation needs to include. We're sort of helping preempt that. I think on a federal level, if the Pfas Action Act were to become law, it would mandate comprehensive health testing for all PFAS, reporting and monitoring of PFAS in drinking water, expanding the work of, this task force. Additionally, it would provide grants to those impacted water systems. And I fully expect that many communities in Massachusetts could take advantage of those, given that they would best understand their unique needs when working to address contamination. As you all know, the Massachusetts Department of Environmental Protection published a bold PFAS, public drinking water standard called a Massachusetts maximum contamination level of 20 nanograms per liter. So similarly, the PFAS Action Act, which will require the EPA to set a national standard after a public notice and comment period, in the case of Massachusetts levels are more strict. They will remain the standard, but I think what Massachusetts has really done is kind of set the bar on, how we approach this debate from a federal level, and the federal law, ultimately, federal laws will help set a clear, consistent baseline for ways to measure and treat PFAS. So really just thank you for everything that, you're doing. Certainly shining a spotlight on this issue helps build awareness and education around the need for, us to take action both at the state level, but certainly at the federal level as well.
Thank you, Congresswoman.
Thank you. I think we have time do you have time for just one or
Sure.
two more questions?
Yeah.
Okay. I see a question from Representative Pease.
Hello, Congresswoman, and thank you so much for being here today. I really appreciate it, and I'm a freshman, so I'm a newbie, so take that into account. But so I'm just wondering, so how is the bill looking in the Senate, and should we be also like the chairwoman said, reaching out to our senators, Markey and Warren, or they have already signed on to it, or where's it at? I guess is my question.
Yeah, you bet. It is going to make its way through the Senate. It is, you are probably aware, we're tracking a lot of important initiatives right now in the Senate and in both chambers. The PFAS is addressed in the bipartisan infrastructure bill, so that is a really good sign in terms of us, moving on something that addresses the mitigation of PFAS. Clean drinking water was a priority in the bipartisan infrastructure bill. The text currently includes $800 million per year in capitalization grants to address PFAS contamination under the Safe Drinking Water Act. That legislation includes programs specifically aimed to help small and disadvantaged communities and funding to help drinking water utilities remove PFAS from drinking water supplies or to connect well owners to local water systems. So My office will certainly be involved as this legislation moves through the House. It never hurts to call our senators, although I know that they're supportive of this, the PFAS Action Act, as well as making sure that the clean water is a priority and it's funded at a level that we need it to be in the Bipartisan Infrastructure Act as well. Thank you.
Thank you so much.
Well, one last question, brief question from Representative Kearns.
Thank you. Thank you, Congresswoman. I think you answered it. My question was going to be, will the federal infrastructure funding, apart from the federal legislation that's already gone through the House, will it address PFAS? And it sounds like it will.
Yes. And right now we're making sure that, there's a number of things right now that I think with the bipartisan bill, also with the budget reconciliation bill, and look, there's more to do even after those two pieces of legislation are passed. And so, I know that there's, because of the actions that the House has taken, whether that's the Clean Futures Act, certainly this, PFAS Action Act, we want to make sure that those are reflected in these two major bills. And if not, that we continue to make sure that these are taken up, in the fall.
Well, I want to thank Congresswoman Trahan for joining us again today. Really thank you for the time. It means a lot. Certainly, I feel very fortunate to have Kate Hogan as my co-chair here, and we're in very good hands having you be able to join us. So thank you so much. We're now going to hear from Dr. Pat Bricey, who's the director of the National Center for Environmental Health and the Agency for Toxic Substances and Disease at the Centers for Disease Control and Prevention. Dr. Bricey joined CDC in December 2014 as the director of the National Center for Environmental Health and ATSDR and CDC's efforts to investigate the relationship between environmental factors and health. Under his leadership, the agency has prioritized work on safe drinking water, initiated new ATSDR actions to address exposures to hazardous chemicals, and has played a critical role in the CDC's emergency preparedness and response to natural disasters and chemical exposures. Dr. Bricey is committed to addressing current safe water challenges in the United States. Since arriving at CDC, he has led the public health response to the Flint water crisis and remains focused on preventing lead exposures from public drinking water. NCEH ATSDR is a leading federal partner in the effort to expose PFAS, identify cancer clusters, to maintain water safety, for instance, recreational water, water from private wells, irrigation water used in agricultural settings, and to address public health implications of drought and presence of biofilm organisms in aging water infrastructure. Dr. Bricey received his PhD in environmental health engineering from Johns Hopkins University and completed postdoctoral training at the British Institute for Occupational Medicine in Edinburgh, Scotland. I want to thank Suzanne Condon for making this introduction, and really want to thank Dr. Bricey for giving us his time. This is a very high-level presentation from someone who's leading at the highest levels of our federal government. Dr. Bricey, we see your presentation is queued up and ready to go. Thank you for joining us.
Fantastic. Hope you can hear me all right. Somebody say so if you can't.
We sure do. We hear you loud and clear.
Good. And sorry about my informal background. I was, still learning how to use this technology, and I can't figure out how to change it. I have a more professional background, but if you don't mind Mount Hood for now, we'll just live with it.
We're good with it. I'm relieved to hear that the federal government has not endeavored into Teams as has the state legislature. You are fortunate not to be using this technology. Anyway, over to you, sir. Thank you.
Next slide, please. And thank you for that introduction. So I want to just say a few words about, you mentioned in my introduction, the Agency for Toxic Substances and Disease Registry. That's a mouthful. It's ATSDR are the initials, and of course people often kind of mix them up. So I'll take any combination of A, T, S, D, and R that you want to use, and I'll understand what you're talking about. But ATSDR was established by an act of Congress in the early 1980s to serve as a partner to the EPA to address the health concerns around hazardous wastes, hazardous material spills, and hazardous releases in the country. So this was at the time of Love Canal, Those of you remember that in Time Beach, Missouri, and the early days of the environmental movement. And so ATSCR is serving in that role for a long time. So our role is to identify the human health effects of hazardous substances. We work with communities. We respond to emergencies. We conduct exposure assessments, public health assessments, and studies. We provide guidance to health departments. So we're a resource to health departments. So we work to build capacity at states. So we give funding to states to address hazardous waste issues. And we did that funding in a number of different ways. We monitor and investigate hazardous exposures, and we develop science-based tools and resources. So I'll talk about how we do this in the area of PFAS now as we go forward. Next slide. So in that broader context, our role is to investigate exposures to PFAS and the possible health effects. So I'll start off by saying there's many things that we investigate where we have a pretty good picture of what the health effects are. We might not always understand at what level those health effects occur, but if you're talking about something like lead or benzene, we know kind of what the range of things are. The challenge with PFAS is many of the health effects right now are not as clearly delineated. So how do you address human health concerns in the face of all this uncertainty? That creates a big burden and a big challenge for us. In this context, however, we need to address community concerns because they're concerned, they're worried about it. So we work closely with communities across the country. We want to make sure the actions that we take are based on scientific information, and we want to make sure that we provide information that supports communities to take action, whether it's themselves or through their interaction with the clinicians in their community going forward. So it's a big challenge for us, and I'll mention that I've been at CDC now for an ATSCR for 7 years. And when I first came, we had one site across the country where we dealt with PFAS exposure. We now have 40 to 50 places where we're actively engaged, either directly ourselves or through our state partners on PFAS exposure. So this issue, as you are well aware, has really mushroomed over a relatively short period of time. Next slide. So I just want to make sure that, with a little bit of background. So some of the challenges are associated with the fact that PFAS is not one thing. It's a family of chemicals. And depending on who you believe, there's over 5,000 chemicals in this family. And we know a little bit about a couple of these chemicals. We know a little bit less about a handful more. The vast majority of PFAS chemicals, in fact, we know very little about what the health effects might be. So you can see already what a challenge this presents as we talk about going forward. So we need to wait in many ways and react to science as it emerges. And I'll tell you, as a scientist, there are literally 30 to 40 publications every month across the spectrum of scientific journals on this issue. So just keeping up on the science that's emerging is a big challenge for us. But nonetheless, that's something we're trying to do. So we're worried about these things because we know that the whole family of chemicals, by definition, don't break down in the environment, which is why they're called forever chemicals. And in many cases, these chemicals, because of their chemistry, not only don't they break down in the environment, they're not eliminated readily from your body. So some chemicals can be eliminated readily. Some chemicals stay in your body for years. And so we think toxicologically differently about whether something is accumulating in your body versus something that is excreted relatively quickly. So we, depending on who you believe, there are many millions of Americans who have PFAS in their drinking water, at or above some health-based thresholds. Some people estimate as many as 100 million, which means 1/3 of the U.S. population, perhaps, depending on where you think that health threshold is. So we began the crusade at CDC and HSGR when the National Center for Environmental Health, the other part of my job, which measures chemicals in people's bodies as part of something called the National Health Examination and Nutrition Survey, and Haynes. We started noticing in the late 1990s that these chemicals were in everybody's body. So automatically, a signal goes off. If I was Batman, it would be a bat signal that, anytime you got chemicals that are accumulating in everybody's bodies and you know very little about them, that tells you we got to worry about it right off the bat. And so shortly thereafter, HSGR started investigating these chemicals and started looking at the toxicology. And that has evolved over time. And I'll spend some time now telling you about where we sit right now in terms of the work that we're doing. Next slide. So people can be exposed to PFAS. One of the challenges is while our mandate is to look at chemicals that are released to the environment, through hazardous material spills or uses or releases of some kind, we also know that we can be exposed to PFAS through many other pathways. So it can be in our homes because of our consumer products. It can be in our food because of packaging that we use. And so one of the challenges we have is how do we distinguish exposures that comes from the environment versus exposures that come from these consumer products? So, when you buy a stain-resistant carpet or furniture, what the exposure from that? When you get the food packaging, what contribution does that have going forward? So we're trying to understand, although it's not our mandate, the broader spectrum of consumer product concerns, because we need to place the exposures that we're talking about in the context of the exposures you're getting through all these other routes as well. Obviously, the health impact is going to be a sum of all the PFAS that builds up in your body, wherever they come from. And so that's why we need to think more carefully about the wide breadth of exposures. Next slide, please. So this is a slide developed by a group called the Environmental Working Group, which is an advocacy group. I'll admit that off the bat. But they're compiling a map of places where PFAS contamination in drinking water or surface waters has been documented. And so there's a couple interesting things about this map. So first of all, you see that there's blue dots across the whole country. But you also see there's some places where the entire state is almost covered in blue dots. And you might think, well, wow, they have a lot more PFAS exposure in those states, including Massachusetts has a lot of blue dots in it up there. But, we've talked North Carolina, we're talking Colorado, we're talking Michigan, California. What's interesting, however, is that these are states that are more aggressive at measuring PFAS in waters. So it might not be that they have more exposures. It might be that they're more aggressive at measuring it. And so we look to states to pick up their PFAS monitoring so we get a clearer picture of where PFAS is so we can understand whether this map is relatively complete or whether, in fact, many states will be filled in along the lines of New Jersey and North Carolina, and states in the Northeast going forward. So you can see the huge public health burden that we're trying to work to protect against. Next slide. So the other aspect of it, so we know it's everywhere. We know it doesn't break down. We know it's in all our bodies. So what do the health effects tell us? So there's also many signals in the health effects literature to suggest this stuff could be very toxic in a number of ways. And it's pretty remarkable, in my opinion, that PFAS chemicals can affect so many parts of the body in adverse ways. So there's not many chemicals that have such a breadth of effect across so many organ systems in your body. Now, I'm going to talk in very high-level terms because I'm an engineer and a chemist by training. I'm not a medical doctor. But we know that can affect cholesterol levels. So the big question is, does that translate into increase or changes in cardiovascular disease? We don't know. We know it can affect vaccine response in children. Does that mean it can affect vaccine response across the lifespan? We don't know. Does that mean that puts children at increased risk for infectious diseases that they might have been protected from because the vaccines are not as effective? We're not quite sure about that. But it's obviously something's having some immune toxicity associated with it. Anything that's immune toxic is something we're worried about. We know it can affect liver enzymes. The liver is a very important organ in your body for detoxifying things. We know it can increase your number of effects in pregnant women and in birth outcome effects. It can increase risk of cancer for kidney cancer, testicular cancer. And of course, not all chemicals affect all these organ systems, but one or more chemical in the PFAS family does these things. And so the question is, what chemicals affect what organ systems at what levels? We need that information to tell communities how to protect themselves. And so we're desperately doing everything we can to understand how these toxic effects translates into everyday risks for people. Most of this data, I'll tell you, comes from studying animals. And as you probably know, it's a challenge to translate research in animals into thresholds and health effects in people. And so one of the things we've been calling for is more studies of epidemiology in humans, so we can look and see if these health effects are actually being recapitulated in people based on what we think we see in animals. Now, there is some limited human epidemiology already, but we're looking to grow that evidence base, and that's part of what we're trying to do at ATSDR. Next slide. So as I mentioned before, here's a map that shows some of the site work that we're doing across the country. And in fact, this map is probably a little outdated. I think last time I heard we're involved in 40 sites across the country. So ATSDR can get involved at a hazardous waste site or a hazardous site with material releases a number of ways. You know, if it's a national priority list hazardous waste site, by law, the law that established ATSDR said we have to work with the EPA to do a health assessment. There's a lot of sites that are concerned that aren't on that list, and EPA can ask us to do a health assessment on one of those sites because they're thinking of putting on the list. State and local health departments can ask us to get involved with the site to do a health assessment. Sometimes we get asked by private citizens. We can get petitioned to get involved with the site across the country. Sometimes we can ask by other federal partners. So in many cases, you'll see that we're involved in sites where the Department of Defense is related to the exposure because of the use of firefighting foam. So in those cases, oftentimes the Department of Defense has asked us to help them by doing a health assessment going forward. So our portfolio of sites, as I mentioned before, are increasing over time, and we're doing our best to keep up with this growing burden. So our long-term objectives are to understand where and how the water is contaminated. And when I say that, we want to understand how that compares to what we get from these other sources I mentioned before. We want to develop a science base that furthers our understanding of the relationship between PFAS and health effects, so we can use that to make evidence-based policy decisions about what's protective. And then we want to make sure that we identify and implement strategies that we think are appropriate to be protective of those communities, and then ultimately evaluate the effectiveness of those strategies. So, for example, one of the things that we work to achieve across the country for now is that if there's any drinking water source that has PFOA and PFAS, two of those 55,000 chemicals that are above the threshold that the EPA established in terms of their long-term health advisory, and if they're above those levels, then we want to make sure that somebody either cleans up the water supply by putting a water treatment system in, or we get a PFOA, PFAS-free supply of water going forward. And that's happening at sites across the country right now, I'm happy to say. Now, we can argue whether that threshold is too high, but at least there's a lot of sites that's works going on to lower those levels for PFOA and PFAS. And I can tell you, if you put a water treatment system in to remove PFOA and PFAS, you drop it well below what the current health thresholds might associate with health effects in most cases. On the next slide. So one of the first things we want to understand is if somebody's drinking these chemicals in their water, how does that translate into what's in their bodies? And then how does that compare to what's in everybody's body based on all these other sources that we've already talked about? So is the drinking water a major contributor to what's in people's bodies, or is it a minor contributor? Before we started our study, we didn't know the answer to that question. And so the first thing I'll talk about is our exposure assessments. So we identified 10 communities you see listed on this slide where we want to go and we wanted to collect in a systematic way people to participate. We want to identify people to participate, and we want to collect some blood from them. We want to collect some urine from them. We want to ask them questions about their drinking water habits. We want to ask questions about what they do for a living, because you can be exposed occupationally. We want to ask questions about certain consumer products that might give us a clue as to the consumer product burden that they might have going forward. And we're doing this to try and understand in a national scale, you see here, the relationship between what's in the water and what's accumulated in people's body by measuring what's in their blood and their urine. So we measure things in the blood, things that stay in your body for a long time. The blood is an effective way to measure Things that get excreted quickly, some of the PFAS chemicals, we look in the urine for that, which is why we measure blood and urine. So I'm happy to say we're approaching the completion of this study. It's taken us a while, and we can go into it, but I can confess that the COVID pandemic created big challenges for us in the work that we do. Obviously, if you're trying to go into people's homes, we couldn't do that at the height of the pandemic. So we went in and we collected the blood, we collected the urine, we took some time to talk to communities about what we're doing, and we got their buy-in going forward, and we did it in these 10 sites. And our goal was to get over 2,000 adults and children in these 10 communities across the country to get this national profile. Next slide. So when we come into a community, and you notice that one of the communities is in Massachusetts, Hampden County, Massachusetts. First thing we do pre-pandemic is we'd have a public meeting and we invite people. We talk about here's who we are. Most people don't know who ATSTR is, so it's a nice opportunity to talk about us because we think we're a modest but mighty, health agency within the federal government. And we have an information sense. We talk about why. Then we go recruitment, where we identify houses, in a systematic way, and we knock on your door. We call them. We do whatever we can to see if they want to participate. We would get as many people to participate as possible. We had target goals for participation. Then once people agreed to participate, we went in the field, and that would mean, going to the homes, collecting a water sample. Sometimes we collected a dust sample, administering a questionnaire, inviting the people to come to get their blood and drawn and urine collected. That's the sample. That's the fieldwork phase. We send the samples to the laboratory to be analyzed. So we use environmental labs to measure the water and dust samples, and our CDC laboratory measured what's in the blood and the urine. Once we got the results, we sent individual results letters and summary data to all participants, and we've completed that for all sites. And now we're in the process of writing final reports where we look at the information much more systematically in terms of how we can relate the PFAS in people's bodies to what we think their water contribution was. So that's a bit of a statistical analysis. It's going to take us a little bit longer to complete, but we're going to start releasing those full reports soon across the country. Now, I'll say soon, and if you ask me, can you be more specific, I'll tell you right now, I'm going to say we're going to do it soon. Having worked for the federal government now for 7 years, I rarely go out on a limb and give any more specific dates because you never quite know what can hold you up. So this is our process. Next slide, please. So I want to show you a little bit of data. So here's the data from Hampden County, Massachusetts. So you see a number of the PFAS chemicals listed down here. So PFAS, PFHXS, PFOA, PFNA, and on down the line. So those are the chemicals that we think had quantifiably meaningful results. We measured much more than these, but these are the ones that we think had measurable results. You see a gray line and a blue line. So the gray line represents what's typical for people in the United States based on that N. Haynes sample I mentioned before. And the blue line represents, what we measured in this particular community. So at the simplest level, the difference between the two is likely associated in some fashion with what's in the water. Maybe not entirely, and that's what we're trying to understand by the more detailed statistical analysis I mentioned before. But in general, you see here in Hampden County, Massachusetts, the PFAS levels are slightly higher, not drastically higher than what's typical for everybody. The PFHXS is substantially higher than what's typical for people. And why we think that's curious is that PFHXS is one of the chemicals we know is a component of firefighting foam. So we weren't too surprised. The other chemicals we see in the list were probably not too drastically different than what we see in everybody else. Just because they're not different than everybody else doesn't mean they're not a health threat. But again, remember, our purpose was to try to understand the contribution of the drinking water to that. So already we're getting some clues here that there is some concern associated with the accumulation in people's bodies based on what was in the water. And I'm going to show you one other site just to illustrate some of the range of results. And in the next slide, we have Newcastle, Delaware, which is another one of the communities. And here you see across the spectrum of the big three chemicals that we think are associated with in this family, the PFAS, PFHXS, and PFOA, and all three of these chemicals in Newark, Delaware, they're Newcastle, Delaware, rather, they're strikingly higher than what's typical. So again, this points us to an interesting conclusion that there's some environmental contamination that's contributing to these differences going forward. So when we're done, we will have the first ever national profile of PFAS contamination from drinking water related to people's body burdens for these chemicals. Now, these are all blood results. Some of the good news we have is that some of the chemicals that are eliminated rapidly in the urine, we found almost no detectable PFAS chemicals in the urine, which was in some ways is reassuring going forward. But these are just blood results. So what we don't have here is, what was measured in people's waters, what we knew historically was in the water. We don't have results of, how much water people drank, because many of you know that you may have tap water, and my friends, for example, never drink their tap water. They always buy bottled water. That doesn't mean the bottled water is PFAS-free either, but it would certainly kind of remove their tap water as a source for exposure. So we'll be able to put some data on that, what we know about how much water people drink, to help us interpret these results a little bit further. So everybody else in the study is probably somewhere between Massachusetts and Newcastle, Delaware, across the country. Next slide. So now the question is, now that we understand a little bit about how people get exposed to water, is it bad for you? And so we've undertaken a large-scale epidemiology study across the country to look at the association between PFAS and drinking water and health effects. And you see the 11 sites here that we're conducting the site in. So what we've done for each of these sites is we've awarded money to a local group. Sometimes it's a university, sometimes it's a contractor, sometimes it's the health department, sometimes it's a combination of the three, to do the health study in their region. They're all going to look at the same health effects, and they're all going to look at some of the things I already mentioned. We're going to look at lipid metabolism, kidney function, thyroid function, liver disease, glycemic parameters, the sugars, and immune response going forward. We seek to enroll 6,000 adults and 2,000 kids across the country to complete the study. Other than in Pfas, New Hampshire was a site where we started the study just to develop our methods and get them approved by our federal government in terms of the Office of Management Budget and other sources. And so we got our act together by starting in Pfas. And now we've begun the study in all these other sites across the country. To be honest, we'd hoped to have the study started, a year and a half ago, but we all know what happened a year and a half ago. So as we're crawling out of the pandemic, and hopefully we're doing that, despite the Delta variant, if we can move the country forward as we hope we do, this study will be moving into the field sometime this fall across these different sites. So we look forward to adding to the epidemiology literature to see if these health effects are existing. Now, a number of you are going to say, well, you're not studying reproductive outcomes and you're not studying cancer. That's right, because not every study can answer every question. So we have other efforts across ATSDR where we're trying to look at some of the other health effects. This study design is very specific for looking in what we call a cross-sectional way. It's a one point in time where there's excesses of these conditions, which are pretty clinically relevant conditions that we think we can associate with how much water people drank and how much water these PFAS chemicals have accumulated in their bodies over time. So we're very excited about this study. This will be a groundbreaking effort across the country. Next slide. So as I said, that's not the only thing we're doing. So in addition, we have a small pilot study with the EPA to try and understand what some of these other exposures are in terms of the consumer product exposures and the food packaging exposures to better place the drinking water contribution in perspective. So obviously the EPA is interested more widely about environmental contamination, while HSDR's mission focuses very clearly on these chemical releases that we're focusing on. We're also interested in the impact of PFAS. We mentioned before it's immune suppressant, and there's evidence that it mediates immune response in kids. And so the concern is that people with high body burdens of PFAS Are they going to be at increased risk for COVID disease, and or are they going to be less immunizable going forward? So we have some efforts. We're trying to explore that. Unfortunately, the way science works is we're not going to have the answers to these questions until hopefully after the pandemic has passed. But certainly it will inform future disease outbreaks and our understanding of, in general, about how effective vaccines might be in the face of high PFAS exposure. We want to understand, so one of the big challenges we have is right now, because the data on human science is not as definitive as we'd like, it's hard to convince clinicians, and it's hard to get insurance companies to pay for biological monitoring and specific testing that's related to PFAS chemicals, because there's not what a clinician would call grade A evidence to document that. And so there's a challenge right now that there's getting guidance to clinicians to effectively address the concerns communities have around these questions. And so what we've done is we've turned to the National Academies of Science, Engineering, and Medicine. This is a group that's funded by the federal government, but it's independent federal government, to give us guidance on what we think is appropriate to recommend to physicians going forward. And hopefully, that'll give us the support we need to turn to the clinical community and turn to the insurance companies and say, this is something you need to support, because we think the evidence is there to support this. And how do we know the evidence is there? Because this independent group that's widely recognized worldwide as being experts have said so. So that's why we're turning to the National Academies. And then we're also doing some studies where we're looking at cancer very specifically. So there's a number of opportunities where we've looked at cancer in populations, and what we'd like to do now is go back and measure the PFAS in archive samples from those studies to see now if we can also look at the relationship between PFAS exposures based on those historical archive samples and what we know the cancer risk in these cohorts right now going forward. So we're interested in a wide range of things as we go forward. So we're aggressively pursuing the health research. We're looking for the health research to provide the evidence base to support the policies that we think are appropriate to reduce exposures in communities, to minimize the risk, to get the kind of clinical care that people need to address the possible health effects that may be emerging based on the historical exposure of these chemicals. Many of these exposures, as you know, go back 30, 40, sometimes 50 years since drinking water supplies have been contaminated going forward. So can I have the next slide? So there's a number of sources of information I can refer you to, and I put the URLs, or actually these aren't URLs, these are active links. But if you go to www.atsdr.cdc.gov/PFAS, you'll see all these documents there. So we have a toxicological profile, which summarizes health literature and establishes what we think is our minimal risk level. It has our current clinical guidance, and that's the guidance that's under review right now by the National Academy of Sciences. It gives the tools that we recommend for health departments to do these exposure assessments. And I mentioned those 10 communities. If another community wanted to do an exposure assessment similar, we would highly recommend that they follow the same procedures we did so that you can compare results. If you don't do it that way, it's hard to put your results in proper context vis-a-vis what we know in Haines and what we know across the 10 sites that we did. There are community fact sheets. There's Community Stress Resource Center. We know that oftentimes there's a lot of mental anguish in communities when they find out that they've been drinking this stuff for so long. And that creates an additional burden to the communities in terms of stressors. And we all know that anybody who has increased stress, biologically speaking, that can amplify any health effects that might be occurring for any other reason they might be occurring. And so we're trying to help communities to deal with some of the psychosocial stressors associated with finding out that you've been exposed through this Community Stress Resource Center. So we have a wide variety of resources there. And of course, we make ourselves available to talk to groups across the country like we're doing today to make sure that we build a groundswell of informed citizenry around these issues. Next slide. And I think we can stop here and see if you have any questions or anything you want to discuss.
Thank you, Doctor. Thank you. And are there any questions out there? I'm looking for hands on my rep piece.
Thank you, Madam Chair, and thank you, Doctor, for your briefing. So I know UMass did a study for the citizens out here in Hamden County, which is my district near Barnes, and I imagine that was part of your first study. I just didn't know if you were aware that they are continuing to do a study that they're currently funding themselves, as trying to get some state money to help them to go back and test those folks that maybe have gotten either COVID or the COVID vaccine to see the effects of that on their system with the first sample they took prior to COVID. So I just didn't know if you were aware of that. If you weren't, I wanted to make sure you were.
Well, thank you very much. So we know that there's a lot of efforts across the country to address the health concerns in many fashions, including this one. I wasn't necessarily aware of that, but I suspect some of my staff were. So I'd be happy to go back to them and ask them if they were aware of that, and we'd certainly want to reach out to them and see what they're doing and what they're finding.
Yeah, it's UMass Amherst out here, so thank you.
Yep, I'm familiar with the school.
Dr. Blair Wiley had a question.
Hi, thank you for your presentation. As one of the clinicians on the task force, I was glad to see you raise the work that's being done at the level of the National Academy of Sciences to provide guidance to clinicians, because I think that this group, we haven't really yet delved into that. We get people in the communities worried about their water and asking to have their blood checked specifically for a level, but we have no way to translate that level into useful information. Many of the health effects are pretty common and have other etiologies as well. For example, I'm an obstetrician, so preeclampsia is common. We always screen for it. All of prenatal care is sort of designed to screen for preeclampsia. So the clinical guidance so far for PFAS is screen for preeclampsia. So I think that this uncertainty that you talk about is important for us to acknowledge as a task force. Because then the population thinks the clinicians don't know anything when in fact there actually may not yet be something translatable. So wondering your thoughts on how close we are to getting more information there.
Yeah, so I thank you for those comments. That's probably one of the biggest challenges we have right now, because when I've stood up in front of many communities and you see the anguish, you see the concern. And, so as many of you know, if you go to the doctor and they measure something in your blood or urine or whatever it might be, they do that because there's some sort of benchmark or range of what you compare it to. You say, this is normal, this is not normal, this is good, this is bad. We don't have that for PFAS. But the community say, I still need to know because I'm excreting it right now. And if you come back in 5 years when you know whether something's bad, you can't measure my PFAS accurately now for what it was 5 years ago. And so a lot of times people say, I need to know what's in my blood now, because 5 years from now, we may say that people who had these blood levels are at increased risk for cardiovascular disease. I'll make something up. And so I would never know that unless we did a measurement now, even though there's not a threshold now. So there's lots of reasons why community members want to still have a measurement made. And I sympathize with them. But I also recognize that the clinical community has very, specific ethical, requirements for what you do in a clinical setting and why you do it and how it translates into information you can give to people in an actionable, meaningful way now. And so that's why we hope. So the National Academies is, if you go to their website, if you want to see, they've been holding a number of community meetings about this, and they're all archived, they're all stored. So I'd encourage you to go and look at some of that, and they get feedback across the country. I think we hope to finish up in the calendar year 2022 on getting their guidance together for us.
Thank you.
So this is a big deal in part because these blood tests probably cost about $1,000 a pop, and so it's not a trivial expense. So if you ask your doctor to do it, if your doctor wanted to do it, and your insurance company wouldn't pay for it, are you willing to take the burden of that out of pocket as a cost? I'm happy to say that as opposed to 5 years ago, There are now laboratories across the country that we think, we being CDC, are proficient enough to do these measurements accurately, should people want them. That wasn't the case a few years ago, but it is now. So, and we have laboratories. If you come across that, listen on our website that we think represent proficient laboratories. That if you need to send a sample off, we would encourage you do one of those labs. If your state lab is not equipped to do that, which I think Massachusetts State Lab is.
Thank you to both doctors, and hopefully Dr. Wiley will be dealing with this as we move into further task force meetings, and we're so glad to have you on the task force. Thank you for stepping up from your very busy practice. And we have a question from Assistant AG Andy Goldberg.
Thank you very much, Chair Hogan. Thank you, Dr. Brace, for your terrific testimony and interesting and important testimony. Could you speak a little bit, if you know, to international efforts at coordinating these studies and regulatory efforts in terms of how perhaps that could make our work a little bit more efficient at the state level?
I can talk briefly about it because I can't say much. So ATSDR and CDC are not regulatory. So as you know, there's a lot of pressure on the EPA to mount a more aggressive regulatory posture for these chemicals in the environment. And so someone from the EPA is probably in a better position to place the regulatory interests that they're pursuing in the broader context of the international community. And so we're very careful to make sure people understand that we provide guidance, we provide technical support, but we're not regulatory. We don't have the authority to say that this is an unacceptable level. That's in the EPA's burden, so I'll mention that. But we do keep track of the health literature that's emerging kind of internationally. We do try to follow that. And there's some great stuff coming out of Europe. In particular, they're probably a little bit ahead of us in some ways. And so we are surveilling the international scientific literature. And if a country comes up with a health threshold that they think is a regulatory value, of course we take interest in that. But that's more from just kind of a curiosity from our perspective, since we're not regulatory.
Yeah, no, thank you, Doctor. And that was exactly what I was trying to get at, was kind of the sharing of information in terms of the technical analysis and studies, certainly not from a regulatory perspective. I understand that. Thank you.
Thank you both. And thank you, Dr. Bracey. This is great information. We look forward to your report. We look forward to studies, and we will stay in touch as we move forward. Next, we'll hear from the National Conference of State Legislatures. Kristin Hildreth serves as the Legislative Director at NCSL on Natural Resources and Infrastructure Committee. In this role, she leads NCSL's advocacy work on environment, ag, energy, and transportation, issues that are before Congress and the administration, with a particular focus on environmental advocacy. Shelley Oren is a policy associate in the Environment, Energy, and Transportation program at NCSL. In addition to covering a range of environmental policy topics, she staffs the State and Tribal Government Working Group, which brings together state agencies and Native American tribes impacted by the cleanup of federal nuclear weapons facilities. Kristin will provide an overview of federal action on PFAS contamination, and Shelley's presentation will focus on state action. So take it away, NCSL.
So good morning, and thank you to our co-chairs, Representative Hogan and Senators here, and the members of the task force for having the National Conference of State Legislatures present before you today at this 5th meeting of the PFAS Interagency Task Force hearing on both federal action and legislation in other states to address PFAS contamination, detection, disposal, and remediation. My name is Kristin Hildreth, and I serve as NCSL's Legislative Director for Natural Resources Infrastructure, and I'm joined by my colleague Shelley Oren, who is a Policy Associate in NCSL's Environment, Energy, and Transportation program. NCSL represents the 50 state legislatures and the legislatures of our nation's Commonwealth, territories, and possessions, and the District of Columbia. Our mission is to strengthen the institution of the legislatures, provide connections between states, and serve as the voice of state legislatures in the federal system of government. So today I'm here to give you an overview of the federal action we've seen on PFAS thus far, although I'll steer clear of the work that CDC is doing, given Director Bricy has covered that. The Environmental Protection Agency has committed itself to moving forward with several actions aimed at helping affected communities better monitor, detect, and address PFAS. The first of those actions being in 2016 when EPA published a health advisory, but not a regulatory standard, on PFOA and PFAS, establishing safe levels of the chemicals in drinking water at no more than 70 parts per trillion, and then following several meetings with other federal, state, and local government stakeholders, unveiling a formal PFAS action plan in 2019, which the agency later updated in 2020. That plan outlined the agency's long and short-term actions that it planned to take surrounding the chemicals, including but not limited to developing a maximum containment level for states and local water utilities via the Safe Drinking Water Act, listing PFOA and PFAS as hazardous substances under the federal Superfund law, considering listing the chemicals in the toxic release inventory, and then developing new and better methods to really detect the chemicals in drinking water, soil, and groundwater. Many of these are initial steps in the regulatory process that could potentially take many years. So to date, the agency has issued groundwater cleanup guidance, is moving forward to develop a national drinking water regulation for PFAS and PFOA. They've issued a proposal ensuring that new uses of certain chemicals within the class cannot be manufactured or imported without notification and review under the Toxic Substances Control Act. They've initiated first steps in the regulatory process for listing PFOA and PFAS as circular hazardous substances, and have announced a new testing method for other PFAS chemicals in drinking water. Most recently, the agency established a council on PFAS, which will ideally develop a multi-year strategy to safeguard the nation's water, air, and land from PFAS contamination, reviewing all of EPA's ongoing actions surrounding PFAS to date, and really enhance engagement and consultation with states and tribes. They'll also work to maximize the impact of EPA funding and financing programs to really support the cleanup of PFAS pollution, with a particular focus on underserved communities. Just adding to the work that EPA has already done to try to highlight the ways that existing programs, like their state revolving funds, can be used to address PFAS. While the federal government continues to work towards regulating the chemicals, Congress is also working to develop legislation to address them. So as I mentioned previously, EPA has taken several actions to address PFAS, including adding certain chemicals to the toxic releases inventory list and providing guidance on different techniques and treatments that may be used to destroy PFAS and PFAS-containing materials from non-consumer products, including firefighting foam. Those two actions were a direct result of the 2020 National Defense Authorization Act during the 116th Congress. And if we can move to the next slide. Additionally, with the annual appropriations process in 2020, several PFAS-related actions were included, with those of note being $20 million to EPA to be sent to states to address PFAS contamination through treatment, remediation, and cleanup, $44 million to EPA for priority actions that were included within its action plan, and a particular directive to the Food and Drug Administration to determine whether food packaging with PFAS chemicals continues to meet the safety standards of a reasonable certainty of no harm under intended conditions of use. Now, these are not all of the requirements of PFAS that were in the appropriate acts, but a couple of the major ones. And in this current Congress, they've already addressed PFAS in a variety of different and indirect ways. Notable pieces of legislation that have been introduced and passed in this Congress include the American Rescue Plan Act, which included language allowing states to use funding to make investments in water, sewer, and broadband infrastructure. Per the guidance that was released by the Treasury Department, states can use those funds for eligible products under both the Clean Water and the Drinking Water State Revolving Funds. For EPA, since PFAS chemicals qualify as emerging contaminants, infrastructure needs related to addressing PFAS are eligible products that could potentially include the funding and upgrading of treatment technologies. The Pfas Action Act passed the House in mid-July with bipartisan support, and you've already heard from Congresswoman Trahan, so I won't delve in too deep, but the bill would require EPA to establish a national drinking water standard for PFOA and PFAS, designate PFOA and PFAS as chemicals as hazardous substances, and require EPA to determine whether or not to list others within the chemical class, and also designate both of them as hazardous air pollutants. Of additional note is the bipartisan infrastructure framework, which we heard a little bit about, but according to the final text released late Sunday, will distribute $10 billion to address PFAS and other emerging contaminants in drinking water and wastewater via EPA state revolving fund programs, with all funds being eligible for loan forgiveness. $1 billion of that would help wastewater utilities address PFAS in wastewater discharges via the Clean Water State Revolving Fund. $4 billion of that would go to address PFAS in drinking water through the Drinking Water State Revolving Fund, and $5 billion of that would be explicitly outlined for small and disadvantaged communities to address those emerging contaminants. And just a quick note, it's my understanding that as of yesterday, Senator Gillibrand is actually proposing an amendment to the bipartisan infrastructure framework, which could potentially require EPA to establish maximum containment levels for PFAS, which would, and there's another that would also direct the agency to set water quality criteria for chemicals under the Clean Water Act. It's unclear whether or not this amendment will officially get proposed on the floor or if we will even see it pass, but it is something that's in the works. Other pieces of legislation in this Congress have focused on enhanced detection and research, the creation of new regulatory mandates, cleanup assistance, exposure to PFAS contamination at or near military installations, and manufacturer accountability, although it's clear that states have really been at the forefront of tackling PFAS. And with that, I'll turn things on over to my colleague, Shelley.
Thanks, Kristin. I'd like to begin with a high-level overview of legislative activity over the past couple of years. In the historical absence of federal action on this issue, states have led the way in addressing PFAS contamination, and state legislative activity on the issue has increased over the last few years. In 2019, state legislatures considered at least 106 bills with language on PFAS. In 2020, states considered at least 180 bills, and in 2021, at least 196 bills with language on PFAS. States are looking to address PFAS by targeting primary sources of contamination and initiating cleanup of areas that have been contaminated. Some of the major areas where states are taking action include drinking water, firefighting foam, food packaging and consumer products, landfills and wastewater treatment, and funding the cleanup and remediation of contaminated sites. And on this slide, you'll see a map of states with enacted legislation in 2021 aimed at addressing PFAS in some of the categories I just mentioned. Drinking water is a primary area of interest for states addressing PFAS. With the absence of a national maximum contaminant level, or MCL, states have led the way to establish or propose their own limits for PFAS in drinking water. For example, in 2018, New Jersey became the first state to adopt an MCL for PFAS. Other states that have final or proposed MCLs for PFAS in drinking water include Massachusetts, Michigan, New Hampshire, New York, Vermont, and Wisconsin. Some states, such as California, Connecticut, and Minnesota, have adopted health guidance or notification requirements for PFAS in drinking water. In addition to adopting MCLs and health guidance or notification requirements, states have taken action to test and monitor drinking water supplies. For example, in 2018, Michigan began conducting a first-in-the-nation study of public water systems across the state. In recent years, we've also seen states address PFAS in firefighting foam. PFAS are prevalent in Class B firefighting foam, which has been used to extinguish flammable liquid fires. This has been linked to the contamination of groundwater and drinking water, particularly around airports and military bases where it has commonly been used. States are leading the way, with the state of Washington in 2018 banning the manufacture, sale, and distribution of Class B firefighting foam. Other states have followed suit to ban or limit the usage of Class B firefighting foam, require reporting when it has been used, and establish take-back and disposal programs. For example, this year, Connecticut enacted legislation prohibiting the use of Class B firefighting foam for training or testing purposes, and also directing the Commissioner of Energy and Environmental Protection to develop a take-back program for municipally owned Class B firefighting foam. Maine also enacted a bill in 2021 that prohibits firefighting foam containing intentionally added PFAS from being manufactured, sold, or distributed in the state. Further, Illinois considered legislation that would prohibit disposal by incineration of any PFAS, including firefighting foam. PFAS have also been used in a variety of products, from stain and water-resistant fabrics and carpeting to cleaning products, clothing, and children's toys, food packaging, and cookware. States have taken action to increase transparency regarding the use of PFAS in products and or eliminate the use of these chemicals in certain products and food packaging. For example, in 2018, the state of Washington prohibited PFAS in food packaging by 2022 if safer alternatives can be identified. More recently, Maine enacted a bill in 2021 that will ban the use of PFAS in all products, except in instances where its use is currently unavoidable. This bill also specifies that manufacturers of products for sale in the state that contain PFAS have to notify state authorities. Vermont also passed a comprehensive bill prohibiting PFAS in food packaging, rugs, carpet treatments, and ski wax, and Maryland enacted legislation banning the use of certain chemicals, including PFAS, in cosmetics. Next, I'll speak about state efforts to address PFAS contamination associated with landfills and wastewater treatment plants. Landfill leachate and sludge from wastewater treatment are common sources of PFAS water contamination. States have looked to address PFAS in landfill leachate through testing and monitoring. For example, Rhode Island considered a bill in 2021 that would require the Department of Environmental Management to develop standards for groundwater and leachate monitoring at and around landfills. Some states have also identified sludge or biosolids left over from wastewater treatment as an area of concern, as biosolids are often applied on farmland. For example, Minnesota recently appropriated funds to the Commissioner of the Pollution Control Agency to help municipal wastewater plants, landfills, and compost facilities protect human health and the environment by developing strategies to manage PFAS in land-applied biosolids. Cleanup and remediation has continued to be a primary area for legislative activity. State legislatures are evaluating ways to remediate PFAS present in soil, drinking water, surface water, and groundwater, and determining how to fund various cleanup activities, including implementing testing and monitoring requirements and administering programs to collect and dispose of firefighting foam. Some examples of recent initiatives include Colorado's PFAS Cash Fund, which is funded by fees collected from manufacturers of certain hazardous substances. The PFAS Cash Fund is used to fund the PFAS Grant Program, which provides funding for the sampling, assessment, and investigation of PFAS in ground or surface water, water system infrastructure used for the treatment of PFAS, and emergency assistance to communities and water systems affected by PFAS. The PFAS Cash Fund also supports the PFAS Take-Back Program, which is used to purchase and dispose of eligible materials that contain PFAS. To highlight a couple more examples, in 2021, Maine created the Land Application Contaminant Monitoring Fund to test soil and groundwater and mitigate contamination, and Washington allocated funding to implement recommendations from state agency chemical action plans, including remediating PFAS contamination in drinking water and monitoring the results. Because the extent of PFAS contamination is not fully known, states have sought to address knowledge gaps by working with public institutions to conduct research. For example, the North Carolina General Assembly passed legislation in 2018 to fund a multi-university PFAS research initiative called the PFAS Testing Network. States have also created task forces to conduct studies and implement recommended actions. This year, North Carolina considered a bill to establish a PFAS task force, and other states, such as Connecticut, Michigan, and Pennsylvania, have established PFAS task forces or response teams to identify sources of contamination and implement state action plans to address the issues caused by PFAS. Further, states are looking to conduct studies that are specifically aimed at evaluating how PFAS is impacting particular communities and groups of people. For example, Maine recently enacted legislation to develop a comprehensive research plan to identify farmers who are or may be affected by PFAS contamination. States have also considered policies related to increasing accountability for PFAS contamination, including holding polluters accountable for the costs involved with cleanup, issuing statewide directives directing corporations to address PFAS contamination, and extending the statute of limitations for PFAS lawsuits. For example, in 2021, New Hampshire considered legislation that would require a specific corporation to pay for remediation of water contaminated by PFAS, And New Hampshire enacted a bill specifying that a civil action arising out of harm from PFAS exposure may be brought within 6 years after the date that the plaintiff discovers the injury. Additionally, some states have taken steps to address PFAS through legal action. For example, states like Michigan, Minnesota, New Hampshire, New Jersey, New York, Ohio, and Vermont have sued the manufacturers of PFAS chemicals, arguing that they have threatened public health and the environment. Finally, I'd like to touch a bit on PFAS and environmental justice. In recent years, states have started to examine the intersection of PFAS contamination and environmental justice. Some studies by advocacy groups have determined that low-income households and communities of color are more likely to live near and be impacted by contaminated sites. So states are looking to address this disparity. For example, Illinois recently considered a bill that would prohibit the disposal of firefighting foam containing PFAS in an area of environmental justice concern. Vermont considered legislation in 2021 that would establish an environmental justice policy for the state and require state agencies to incorporate environmental justice into their work. This bill notes that water contaminants like PFAS are disproportionately found in communities in the state with higher populations of low-income individuals. To wrap up, given the growing understanding of the extent of PFAS contamination that exists throughout the United States and the impacts associated with this contamination, states are expected to continue to take action on this issue in the coming years and beyond. Thank you, and Kristin and I would be happy to answer any questions you may have.
All righty. We're going to open for questions. I see a question from first Jennifer and then Suzanne.
Thank you, Senator. Great presentation, really informative. Thank you very much. Shelley, I think you mentioned Illinois had banned incineration. Did I hear that correctly?
I believe they did consider a bill. Let me double check.
I think it would be helpful if you could send information on that, just because I understand at least that incineration is the main disposal for getting rid of PFAS, especially on water treatment media. And so if states are banning incineration, I'm wondering what the solution is to disposal.
Yes, I follow up with some information. I don't have the answer readily available, but I made a note and I'll definitely follow up.
Great, thank you very much.
And Jennifer, I'll just quickly add on to that. So the 2020 NDAA did require EPA to release guidance on different techniques and treatments to destroy PFAS. I don't believe that's been completed, but I can send around an update on that as well.
Great.
Suzanne Condon, and then go ahead. Go ahead, Representative.
Suzanne Condon. Thank you, Senator.
Very quick question, if I could, for Shelley, and thank you both for your presentation. I'm always impressed with the National Conference of State Legislatures. I had a lot of experience working with your folks over the years in my previous capacity. You mentioned several states that have set drinking water standards across the country, most of which are in the Northeast. Have you guys done any analysis to look at the comparability of those levels and whether they relate to the same PFAS constituents, or is it pretty much all over the map? Which, of course, speaks to the issue of why, as a former state manager in public health, I always wish that the federal government set something so that we didn't have to take this kind of action. But just curious if you guys have had a chance to look at that.
Yeah, thank you. That's a great question. We haven't, but yeah, I have made a note, so I will definitely be looking into that. But I don't have anything on that to share right now.
Thank you, Shelley. And that is truly how NCSL works. We'll look into it. Thank you. Yes. Jeffrey Arps has a question.
Hi, good morning. Thank you for your presentation. There's a lot of talk about managing AFFF, but I know, Connecticut recently banned PFAS products with a caveat that the FAA still requires AFFF at airports and Air Force bases. Has there been any legislation or pushing manufacturers to come up with fluorine-free foams or other non-PFAS alternatives?
Yeah, so I will note that in the legislation I've seen, there has been language about trying to identify safer alternatives, but recognizing that there are currently situations, as you mentioned, where there have to be exemptions, just given the nature of what they're being used for.
Thank you. And thank you, Kristin and Shelley. We're very grateful for your presentation. And so our last presenter is Kathy Mame, and she is with the New Hampshire Department of Environmental Services. We're very excited to have her here today. She's an administrator in the Air Resources Division at the New Hampshire Department of Environmental Services since 2016. She's actively collaborated with organizations around the country on air-related PFAS issues. Her work on PFAS in New Hampshire involves identifying potential PFAS emission sources, stack testing air emission sources for PFAS, and deposition modeling of historical and current PFAS emissions from industrial facilities. I'm very interested to hear this presentation, and welcome, Kathy.
Well, thank you very much for having me today. I think it's a vital asset to the group to have interstate collaboration because we're all at a different point in our understanding of PFAS and can all contribute to the conversation. So thank you very much for having me. Can you see my slides?
Very well.
Okay. So I was asked to talk a little bit about our particular air emissions source, but I wanted to cover briefly what types of emission sources you might be concerned about from an air perspective, because primarily the focus has been, as we've heard this morning, on groundwater and on other issues related to that. Air is an emerging area of study, and so I just wanted to bring up to the task force the idea that not only do the manufacturing facilities, the big companies that make this product contribute to air emissions of PFAS, but the industrial facilities that actually buy the raw materials also have a potential to release to the atmosphere or to the groundwater. And so I just wanted to bring that to your attention. The focus I have is with a particular industry here in New Hampshire that coated fabric with polymers, and the way that it worked is that it was a liquid coating that, in order to keep the polymers in suspension, needed PFOA as a surfactant within that coating. And so that's the experience that New Hampshire has. But this type of operation could be, observed in other types of manufacturing, whether it be medical tubing or wire coating or any other kind of polymer type operation or industrial facility. But I also wanted to point out that not only are industries that use polymers potential sources, but also those who have used PFAS compounds, not for the product they make, but for, in this case, prevention of hexavalent chromium from being, for the workers in the facility to be exposed to it. And in the past, they used this as a mist suppressant within the chrome plating industry. And in particular, Michigan and Minnesota have had a lot of experience with this, as well as some work with EPA on testing for this potential air emission source. We had a chrome plater here in New Hampshire that used it as a mist suppressant, and then my understanding is used an evaporator to reduce their waste volume to get rid of the waste, and that evaporator had a potential to release PFAS to the atmosphere, localized emissions. As we've heard, there's a lot of talk about PFAS from landfills, wastewater treatment plants, and Department of Defense airports using AFFF. From an air perspective, there have been studies of ambient sampling around landfills and wastewater treatment plants. The levels are in picograms, so an order of magnitude below what you would see for a stack test type of situation. There is some studies being done down in North Carolina on PFAS and the potential for it to exist within landfill gas, which is an area that is up and coming in terms of research, but not an issue that's been brought up as far as I know, other than through research. As you've heard, the sludge from wastewater treatment plants contains PFAS. It has to be disposed in landfills or incinerated, or it's used as a biosoliid on land applications. So our area of interest in that is of course, the incineration of sewage sludge. And then finally, there's been some studies that show that the use of AFFF, as you would imagine, foam travels with the wind and could potentially travel off-site from an air type of situation, more of an area source than a production source. But I just wanted to, put this kind of information out to the task force before I actually talk specifically about the facility in New Hampshire that we're here to talk about. So when the facility in Merrimack in 2016 tested their public water system and found 30 parts per trillion of PFOA in the water and reported it to the department, in conjunction with the Air, Water, Waste Divisions, the compliance at the Commissioner's Office, and the Department of Health and Human Services, we created a task force to look at many different issues. One of the areas was not just on this particular location, but to verify that there weren't issues at other industrial facilities throughout New Hampshire. This is not an all-inclusive list of where PFAS could be found, but it was a list that started the process here in New Hampshire of trying to make sure we didn't have another facility other than the main one that everybody is familiar with here. So I would recommend that if you wanted to know the history and use of PFAS, I have a link to the ITRC fact sheet at the bottom here. That's a group of consultants, regulatory agencies, industrial facilities, and whatnot that are working on PFAS issues nationally. And so that's a very good resource for PFAS in general, but this one particular fact sheet on its history and use that might be informative to the group. We took this list of commercial and industrial users and identified what possible SIC code or NAICS codes, which are basically just codes related to the industry that are used to identify industrial facilities. We use that information to go through our hazardous waste and air databases to identify what potential sources could exist in New Hampshire. And that became the starting point for an investigation into where we might find this at other locations. So there was an attempt to submit or send out letters with surveys about potential PFAS usage. The results of those surveys then informed us as to where we might want to either test water around these facilities, do a comprehensive, all-inclusive inspection at these facilities, or in some cases, a full-blown site investigation. And so this, I would say that we have two main air sites in New Hampshire, but this also informed the Waste Division, which did their own investigations or had these sources do their site investigations. So this was sort of the source identification process that we followed. In addition, this has been going on since 2015, 2016 timeframe. So we as a department, as well as responsible officials, industrial locations, and various water systems and whatnot, have done an extensive amount of sampling and analysis of water, of landfill leachate, wastewater, soil, air emissions across the state. We have a website with a link to the map that would tell you anything you wanted to know about, the results of water samples throughout the state, but also leachate and other types of sampling. So I just wanted to familiarize yourself with the fact that we have an extensive amount of work that's been done here in New Hampshire. As I said, I'm going to be focused primarily on the air portion of that. So the particular facility is St. Cobain Performance Plastic in Merrimack, and after they reported their water levels from their public water system, we as an agency had formed this task force, and we in AIR had already been familiar with the facility and the fact that they used the ammonia salt of PFOA in their dispersions because the facility, as part of the stewardship agreement, had agreed with the manufacturers of these raw materials to do a dispersion material balance. So they were one of the sites that did a stack test to inform the manufacturers, who then used that information for EPA as part of the stewardship agreement back in the 2005 timeframe. They did some stack testing. There's no certified stack method out of EPA for doing air emissions testing, and still is not, but the stack testing company devised a method. They tested one of 13 towers. They only tested for PFOA, but the results combined with a dispersion model that air regulators use to figure out where emissions will go and how high the concentrations will be for people to inhale, the results indicated that they would exceed our state air toxics rule, because we actually have the ammonia salt of PFOA on our list of regulated air toxics. And so as a result, we entered into a consent decree with the company back in 2006 and required the reformulation of the raw materials to reduce PFOA concentrations from 2,000 parts per million in the raw materials down to 75 parts per million, over a 96% reduction in PFOA emissions back early 2000s. So I just wanted to mention that they had already reduced at that point, but we already were familiar with the company. So when we found the issue of contamination within the water system, we went back and looked at what we had for information. So we had the stack test information, we had the history of the amount of towers that operated there, and combined with the dispersion characteristics of the facility, we did a historical deposition model. Basically, we looked at, since 1986, when they first started operating, all of the meteorological conditions that occurred during that time frame, and ran a model to see where this would have deposited on the ground. Because as the studies have shown out of West Virginia, the emissions of this compound deposits on the ground, enters into the groundwater, and becomes an issue that way. So we did an evaluation of this historical emissions of PFOA and identified the area that we believe was contaminated as a result of the air emissions. The purpose of this was not really that the numbers are an indicator of anything, but more the shape of the deposition model, because initially when we did the first analysis when we first found out about the water contamination, we were looking at wells within a half a mile circumference of the facility, then a mile, and then a mile and a half. And we wanted to really make sure that we didn't miss any wells and had anybody drinking contaminated water. So we wanted to use this to start to inform our search committee as to where to do testing. We also wanted to determine how big an area we were talking about. So as you can see, it's primarily a north-south oval type situation, and this became the way that we proceeded with testing of well water. And ultimately, St. Gobain entered into a consent decree with the department to provide first bottled water and then public water systems within a consent decree boundary that is very similar in shape to the air deposition model. So this all occurred, as I said, back in 2016 when we first identified the problem. We did further stack testing at that time to see if there was continued emissions of PFOA. We hired a stack testing company. Then the company also hired one and did a couple rounds of testing in 2016. There were still some PFAS compounds being emitted, again, using a test method that isn't certified by EPA. At that time, only looking at one tower. And of course, detection levels are starting to get a little bit better at that point, much more precise than back in 2004. This is certainly an evolving methodology that has changed over time and gotten better with detection levels. So then in 2018, we had the opportunity to work with EPA's Office of Research and Development. They are able to do what's called non-targeted analysis. So they can look at raw materials or soils or water or air samples and determine, are there fluorinated compounds in there? Not how much is in there, but if there are any present. And we worked with them and the company to allow us to do sampling at the facility and provide those samples to EPA so that they could do this non-targeted analysis with the intention of developing some sort of stack testing methodology. So EPA worked with the stack testing company to make modifications to the testing method. We expanded the number of towers that were tested, including a film line. We looked at a pilot scale control device. And the results of that testing showed that PFAS emissions were still high enough to trigger what I will talk about in a minute, which is our New Hampshire Backed Law. But the results were quite interesting in that ORD submitted a report to us saying that they had detected over 190 different PFAS compounds in that air emission source. They could only identify 89 of them, And they also found 12 within these SUMA canisters, which in the lower corner of your screen shows the SUMA canister collection. That's for the compounds that volatilize less than 100 degrees C. So this information, along with a lot of industrial sampling, really gave us a good understanding of what was going on, we believe, at the facility. So we and the company have tested their raw materials coming in. The stack emission gases, as I talked about in 2004, 7, 16, and 18, and then the company hired a consultant to do some wipes of the roof and found PFAS there. There were complaints across the street of dust in their window and doorways that we took samples outside of the building so as to avoid any kind of internal exposure, sampling of anything that came from an internal source. Found PFAS there. And then the residue that was building up within the stacks and chipping off, as you can see, there's a picture of the char that was landing on the roof. So EPA did some analysis of the raw materials, the char, and the air emissions, and we have reports of non-target analysis of all of those as well, if you're interested. So in 2018, our state legislature passed what I call the New Hampshire Backed Law, but it basically says if a company caused or contributed to a groundwater or a surface water quality standard and continues to emit air emissions that could cause or contribute, they have to evaluate that emission source and put on best available control technology. It also has some requirements if you're going to install a new facility. And then that control device cannot cause or contribute to a violation after it's been installed. So this legislation went into effect in September 2018. We sent a letter to the company. They had 6 months to do a backed analysis, submit their application. That came in 2019. A permit was issued in 2021, February of 2020, with a requirement to install by February of 2021. The control device that they chose that we agreed was the best available control technology is a 3-chamber regenerative thermal oxidizer that basically heats up in temperature to destroy the carbon fluoride bonds and basically converts the PFAS over to hydrogen fluoride. In order to know whether or not this is going to work or not, we had to establish some sort of operating conditions, and we based that information on a technical brief that EPA came out with in August of 2019, in which it stated that a minimum temperature of 1,000 degrees C for 1 second would be needed to do any kind of PFAS destruction. The cost of the thermal oxidizer was over $5.3 million. It took over a year to design and construct. It went into operation 2 weeks ago. They are now looking at a stack test coming up this fall to confirm that the temperature and the residence time is doing what it needs to do to control the PFAS emissions. The important thing to note on this is that the thermal oxidizer doesn't care what standards are in existence. So the law says 4 compounds, PFAS compounds, and their AGQS that are established under the law. But the thermal oxidizer is a device that does science, right? So it's going to break the carbon fluoride bonds regardless of whether there's a standard out there or not. So that is the important feature of the thermal oxidizer. The most important thing, of course, is to make sure that the destruction does not cause products of incomplete combustion. So we want to make sure that it's combusting, effectively, and it will form hydrogen fluoride emissions, which for the bigger facilities, the Chemours and DuPonts and 3Ms of the world that have this type of technology, they would most likely have a scrubber on the end to scrub out hydrogen fluoride. This particular facility, so far from the evaluation, has shown that that's not necessary, but we will be checking that as well during the test. So as I said, we're going to be testing this fall. It's required under their permit to do that within 60 days. They are preparing a pre-test protocol as we speak, and we're hoping to have a very extensive stack test looking at the stack testing methodology that EPA did come out with earlier this year. It's called Other Test Method 45, but also looking at inlet and outlet, the hydrogen fluoride emissions, VOC, RACT, our toxics list. There's a whole host of information that we'll be getting from the stack test, and it's going to be a week-long process, so it'll be pretty comprehensive. There's a picture of the thermal oxidizer about a month ago. We also, as part of the consent decree that we entered into this spring, when they failed to meet the February deadline, we required that the company also do a rainwater study. So they're going to be studying rainwater to see what kind of PFAS background levels are in existence both on property and then at 2 other locations in the state. The state is also doing a little bit of testing of rainwater around the state. And as I said, we're going to continue to work with the EPA Office of Research and Development on both this OTM 45 method and some other methods to get as much information as we can on the efficacy of this RTM. We also were further investigating and evaluating some stack test information from some other industries and reviewing national data as it comes out to understand air emission sources and issues. And the TRI, which is the Toxic Release Inventory, is supposed to come out this year now with PFAS as a required element of reporting. The reporting level is 100 pounds per year, which may or may not be low enough to actually detect issues at smaller facilities, but we'll be looking at that as well to see if there's any other sites in the state. But I'll open it up to questions.
Thank you for the presentation, Kathy. Are there questions from members of the task force? I see Jennifer's hand.
Thank you, sir. I guess I'm not sure if I can't see Commissioner Suberg, but if Commissioner Suberg is still on, I have a question for him related to this presentation, which it seems, so New Hampshire has this standard where you can't violate a surface water quality or groundwater quality. Do we have a similar law or regulation in Massachusetts?
For PFAS, no. This is, New Hampshire is doing a lot of really important and groundbreaking work on air deposition that, we saw from the presenter. And we're taking a close look at it. As you know, we've been looking at groundwater. We've been looking at drinking water. We're mindful of the fact that air deposition is an important area. So it's where our task force within DEP is starting to take a look. But right now, we don't have a similar regulatory approach in place that New Hampshire does.
Other questions? For Kathy? David?
Yes, thank you so much for your presentation. It was very, very thorough. Just had a question about the rainfall testing. Do you know what kind of method is being used? And I ask that because, of course, the compounds can be modified through combustion.
Thank you for the question. That's a very good question. So just to give you some understanding of rainwater studies that have taken place, the University of Wisconsin has been doing some evaluation using what's called the NADP sites, which are locations throughout the country that look at mercury deposition for air programs. They use those sites to sample water, and I believe they were using just the water method, the 537.1, I believe was the method that they used to analyze those PFAS compounds. There was actually a study, and I can send the presentation that Marty Schaefer did over in Wisconsin, but he had identified that actually in Massachusetts had one of the higher levels of rainwater PFAS compositions. I think it was combined PFAS of like 5 parts per trillion, so not above the 20 that you have in your state, but and certainly more PFAS analytes than what you regulate, but I do have that study. So we're looking at it in terms of a water analysis type of approach. If that answers your question.
Okay, thanks.
Great. Jeffrey has a question.
Hey, Catherine, thank you very much. I just want to make sure I understood the slide. You mentioned 12 PFAS compounds in the SUMA canister. Is that like a contaminant in the liner or something, or?
No, so a SUMA canister is a way of collecting certain types of PFAS compounds. I believe they're the volatile, less than 100 degrees Celsius samples. And so it's just a different method than the typical sampling train. This was a methods development project, so they were trying to see if that would be a way to collect some of these gases and analyze for them. So.
Okay, thank you.
Sure. Other questions? All right, seeing none, I really want to thank Kathy again for the presentation and joining us today. So this concludes folks that we're going to hear from today. and brings to conclusion our 5th meeting, which really was about to learn about actions that are being taken at the federal level and in other states. And I think we've got a really good sort of framework here that's going to help inform our work. So thank you all for those of you who were join us today. We had some pretty impressive folks with us. So to reiterate, right, Massachusetts is not alone in facing the public health and environmental concerns related to the presence of PFAS in our water supplies and in our environments. Hearing what the federal government has done and how other states have addressed it is really going to help us, apply our work, basically come up with this report that we're tasked with doing. So, thank you again today for your attendance. If you have further questions, further comments, things that come up, email Griffin in Rep. Hogan's office, email Jeffrey in my office. Minutes of the meeting will be circulated next week to task force members. A reminder to everyone who's joined us remotely, we've got a landing page at the MA Legislature website. It's under the Committees and Commissions tab and then in the Commissions subheading, so check that out. I want to note this is our only meeting for the month of August. The task force will reconvene in 5 weeks from now on September 7th at 10 a.m. via Microsoft Teams. And the topic for the next meeting is going to be building upon today to look at sources of PFAS contamination and who really is responsible for remediation and mitigation efforts. If you have suggestions for people who should speak, let us know. And again, all those contacts go to Griffin Ty in Chair Hogan's office and Jeffrey Soares in my office. And any members of the press who are listening today who have inquiries should direct those to Allison Kenny in Chair Hogan's office and Jeffrey Soares in my office. So thank you all. I hope you all have a restful and hopefully quiet August. Stay safe. Really want to thank everyone for joining. Thank you, Rep. Hogan, for the ongoing partnership. And any final words before we depart?
I would just like to thank everyone for the work that's been done so far. I feel like I've been having a master class on PFAS. Thinking you know what you know is only beginning. And I am both humble but also very excited to know that we can really make a difference here by gathering the information, understanding better what we didn't know before, and moving forward. And I especially feel honored to be working with Senator Julian Sayre in this effort and my House colleagues, Rep. Cairns and Rep. Peace, and all of you. It's going to be a lot of work, but I think we're going to arrive at a great place and feel like we've made a difference here. Thank you, everyone.
Marvelous. All right, we're gonna break from here. Have a good rest of the month, and we will see you on September 7th.
See everybody.
Thank you.
Thanks.